Got it.
Okay, so
All right.
thank you everyone for joining. Um, this is the fifth episode of our Lunch and Learn series, and in this one we're going to do our KLH-OHT 101 update, so you can learn more sort of about the OHT and what we do. So with that, I'm going to pass over to Steph.
Thank you very much, Amanda. I'm Stephanie McLaren. I'm the executive director of this grand adventure called the Kawartha Lakes Haliburton Ontario Health Team. And it is a pleasure to have the opportunity to open the space for some updates and some conversation, hopefully at the end. Next slide, please. So I actually want to start, and you'll hear me reference this many times throughout this presentation, that first of all, we're offering today a snapshot of the work that we've done across the Kawartha Lakes Haliburton Ontario Health Team. And this work represents the efforts of many health service provider partners at the direct service level, at the leadership level. We speak to you today as, or I speak as a member of a very small project-oriented implementation support team. But really the work that's being done across the Ontario Health Team is being done by the service provider partners that I will reference throughout this. So we want to also not only provide you with a bit of an introduction to what an Ontario Health Team is now, it might be different than when we started, and provide a snapshot of the work we've undertaken to date, and also take a glimpse at the future state journey of Ontario Health Teams, what various iterations of Ministry and Ontario Health announcements over the past year have shown us in terms of future direction. And save some time, obviously, to hear some feedback, questions, concerns, etc. from you. Next slide, please. So to begin with, what is an Ontario Health Team? And I will begin this by saying that the vision of what an Ontario Health Team has really been taking shape iteratively with ongoing input from Ontario Health Teams and Ontario Health, shaping and framing that vision of what an OHT will be. And I make that point specifically because you'll see that where we started and the direction we were given has gained further definition as we've gone farther down the journey of OHT work. But we are a collaboration of health and social service providers working together to advance a system of integrated care, using a population health management and equity lens. And we'll talk a little bit more about what that is as we move through some of the project ideas. So our vision of locally connected care is enabled by improvements and transitions in care, connecting people to the right service provider at the right time for their care needs. We want to enhance the ability of providers, physicians, clinicians, and patients to access health information through a single shared record, or at least a portal to access the records from various digital health solutions. We're focusing on integrating and standardizing pathways and models where appropriate, so that often you'll see in some of our work, we take cohorts of patient populations like those with heart failure or older adults, etc., and look at how we can standardize some of the screening and services that are available, so that we create what we refer to as always for everyone events, so that there's standardized levels of care and responses based on those populations of patients and clients. We also really hold dearly to understanding and responding to our local complexities, particularly in a rural Ontario Health Team with small service providers and smaller populations. How can we really create responses that are in keeping with the needs of our very disparate rural communities? And of course, navigation of the system has been an always ongoing struggle in Ontario. So a big piece of our work has been around increasing access and awareness to what supports and services are available for people. And ultimately, our purpose is to have a relentless focus on supporting people to live their healthiest lives possible. So who we are, and this is our governance members. So we have representatives of these organizations on our oversight committee, which I'll talk about in a moment. We have hospital, community care, community support services, partners. Lots of all of our family health teams and in the region and family health organizations are members, as well as our two municipalities. Sorry, tripping over my words. And that's the city of Kawartha Lakes and Haliburton County. And we also have many, many partners that work with us that don't necessarily sit on the governance committee, but they're very, very involved in our on-the-ground work and those like public health and Canadian Mental Health Association, Seniors Care Network, etc. So overall, geographically, we represent City of Kawartha Lakes and Haliburton, which we have an attributed population that's people currently seeking health services in our region of 63,000. We have a patient and family advisory committee that's been very active over the last 3 years in advising and supporting and giving us lots of feedback on our various initiatives and being a part of many of our working groups as well. And overall, we have 36 physicians and 19 nurse practitioners as primary care providers involved variously in our work. Next slide, please. So when we first received Ontario Health Team funding, we were asked to identify what they referred to as a priority population and design projects in response to the needs of that particular population. So initially, our governance group focused on older adults living in community with multiple comorbidities and facing social determinants of health. And the projects in the early days, and this was from June 2021 until October 2022, sort of the highlights, not exhaustive list of what we focused on, but the highlights were implementing a community paramedicine remote care monitoring program, building a pathway to support that work, which I'll speak about further on. We stood up a virtual wellness connection program for older adults and focused on online appointment booking implementation across all of our primary care provider settings. Anybody who was interested in adopting online appointment booking, we supported the implementation of that feature. We were also called upon by Ontario Health to create our first collaborative quality improvement plan, which had mandatory indicators geared towards COVID recovery and support the system and some of the backlogs that had emerged as a result of the COVID lockdown and restrictions. And we did extensive engagement within the city of Kawartha Lakes with community town halls and service provider engagement to better understand the needs and directions that we needed to take in our work. Next slide, please. So now if we received a document or the further guidance in October of 2022 from Ontario Health, which really starts to hone in and focus our work. And that is, I've really carved it out into 3 basic buckets. Advancing integrated care through the creation of integrated clinical pathways and standardized chronic care for heart failure, chronic obstructive pulmonary disease, diabetes, palliative care, mental health, and addictions. And I apologize for all the acronyms, just to use it for space, but I'll try to not use them too much throughout this. We were heartened, at least to see that direction, because we had already identified that as a need in our community and a priority for our work. So there was no pivot that was required there. The second of work is really focused on digital health maturity, and that is essentially the ability to share information across multiple settings and to better understand our population. So this is open for both. This means increasing coordination and collaboration, line of sight into different electronic medical records for both providers and the public. Because often there's challenges in sharing information across the continuum with everybody using different platforms. And so in that respect, one of the pieces we did focus heavily on was our navigation platform, which I will speak to, again, the online appointment booking. And we have some further developments that will guide our work this year with collaborative health information sharing opportunities. And of course, all the while trying to increase our engagement with respect to primary care and our community and understanding the needs of equity deserving populations. Next slide, please. And this is loosely our governance structure. So all of the work that I've identified really lands at these action teams or working groups along the bottom, digital health to mental health addictions and substance use health. We have patient family advisory, lived experience partners embedded throughout that work. That work rolls up to an operations committee, which is really where the decisions in terms of where we will focus our attention and what that will look like and what partners can contribute to the conversation and solutions, that really happens at that operations committee. And then the oversight committee is our overall governance and focusing on advancing the work as needed from that perspective. We meet regularly with the chairs of all of the board of directors from our oversight committee members, and that's the Chairs Council. And we have an emerging very early stages of conversation around the creation of a primary care network. Next slide, please. So as I mentioned, in our first year, we received direction to provide that we had to collaboratively create a quality improvement plan. And this was really, these were metrics that were focused on working down the backlog of system pressures on hospital, particularly, and on preventative cancer screening that have been created through the COVID restrictions. So one of the first one is alternative level of care days, and that's really about improving overall access to care in the most appropriate care settings. An alternative level of care is a designation given to patients in hospital who may not necessarily require the level of care that a hospital provides, but there's no place for them to go. So they're either waiting for a long-term care placement or they are unable to be discharged home with the appropriate level of supports for a variety of reasons. And I'm sure you've heard lots about this in the news over the last couple of years, that is an increasing pressure that our hospitals face. Our hospitals actually have had hospital partners have had lower ALC rates than is common across the province. But what we really wanted to focus on in our work was ensuring that we take an upstream approach. So how do we prevent people from getting to the point that they need to be in hospital and be receiving that level of care? So we've focused on making sure that people in our community are aware of all of the supports and services that are available through our navigation platform, implementing frailty screening pilot projects so that we can heighten the awareness of providers and patients in terms of what supports and services are out there for them. And that was done in tandem with our frailty screening initiative and our Wellness Connections program, as well as all of those remote care monitoring interventions from home care, as well as our community paramedics. They really support people with complex needs in the home to the best of their ability. So we focused on strengthening those responses. The second indicator focuses on emergency. Basically, it's a problematic indicator, but the essence of it is focusing on access to mental health and addictions care in the community, so that the emergency department is not necessarily the first point of contact. So we did a lot of work, again, through our navigation platform, and you'll see further on in supporting a regional project around coordinated access to ensure that the community is aware of what supports and services are available to them, and also that those supports and services are designed and planned relative to the needs specific to our communities. And then we have preventative cancer care. So these are our regular cancer screening initiatives. And our Ontario Health team really took a focus on unattached patients. So those patients in our system that do not have a regular primary care provider, and trying to ensure that they know and are aware of the access that they have to existing screening opportunities. So a lot of this was done in partnership with our Central East Regional Cancer Program, and through outreach events, website work, lots of social media pushes, and some infrastructure to support the ease. And one of those examples is increasing mammograms. So we have an Ontario breast screening program at Ross Memorial Hospital that is now on our navigation platform. Eligible community members can book an appointment right online for a mammogram, right from the platform. up-to-date colorectal screening. That's a lot of outreach and awareness of how to access a fit test, and the number of patients with an up-to-date pap test. So we have had multiple partners, midwifery clinics, Ross Memorial Hospital, who have created opportunities for cervical screening for women who may not be attached to primary care. So that has been the focus of our work moving forward, past and moving forward. So I won't go in great length about the navigation platform because we have done an actual lunch and learn specifically on the navigation platform, which you can access through our website under resources. It's got lots of great information. But what's important about this navigation platform is that it is both a public and provider-facing platform. It's the very same one that the public uses, and primary care providers and clinicians throughout our Ontario Health Team region also have access, and beyond, actually. Anybody who has access to Ocean e-referral has access to this platform seamlessly. And many of the programs that are on it are utilizing the self-referral option so that clients or caregivers can easily either just refer through the platform and get a call back from the service provider that they've reached out to, or in some cases make direct appointments with them for an intake and assessment. And it allows agencies and organizations to more seamlessly refer to each other through a privacy compliant platform, which is often not the case. So we're trying to get rid of the fax machines and all of the conundrums and challenges that paper-based referral system that the healthcare system is so known for, trying to get rid of the fax machines. And again, as I mentioned, the Ocean integration for ease of referrals directly from primary care, electronic medical records, hospital clinical information systems, et cetera. They're all linked into the same platform. And our service providers have their own accounts on this platform so that they can maintain it and keep things as up to date as they want and change when relevant. So it's quite a nimble system that we're very pleased to have launched. Next slide, please. Our website is essentially a navigation platform. So the CareDove solution is under the Find Services tab, and how we can help you has broader categories of care that we know people are looking for and that we may not be able to put on the CareDove platform, but that we can link directly to the relevant websites so that they can get connected with the care and services that they need. So next slide, please. It's just an example of what's on our website versus the service finder. And we've focused on really, this is the big question, as you can imagine, that we get asked regularly is where can I go for services if I don't have a primary care provider? So we've ensured that we maintain up-to-date listings of all of the urgent care clinics available throughout our region and other supports and services that are there. Next slide, please. And again, I highlight the functionality of the platform. We have lots of opportunities to improve how our service providers are using it for their own workflow processes, but I just highlight the breast cancer screening as one of those initiatives that has really optimized what can be done. So you click on that, learn more. Next slide, please. And it'll take you directly here to book, which is back to the CareDove website. Next slide, please. And then this is the view, again, just highlighting a high level what our service provider clinicians in the system see and are able to refer directly to. It populates right from their electronic medical records, so they don't need to duplicate demographic information, et cetera, and just creates a one-click kind of experience for clinicians to refer to relevant programs for their patients. Next slide. So this navigation actually started a conversation in our OHT, which has been taken up with great gusto, particularly from our community care City of Kawartha Lakes partners around social prescribing. And this is really ensuring that people are attached to a broader range of supports and services that that can support them in their wellness journey. So this might be programs like maybe some social recreation programs offered by community groups or churches, et cetera, not necessarily your traditional healthcare service providers. And it's really focusing in the initial stages on a community campaign to end loneliness for older adults, because we know that loneliness is one of the biggest predictors of negative health outcomes for older adults. So that's an emerging focus, and we will have more to share in the coming months around accessing the social prescription program, but we're really very excited about that work being done. Next slide. And this is our Wellness Connections program. As I mentioned earlier, this program is now being offered by Community Care and Halliburton Hoyland's Health Services, Community Support Services programs. And it's designed as a learning management system that's built around the Avoid Frailty framework and includes additional modules around sleep and falls. It's an online learning program that's designed to be user-friendly, provide education, motivation, and connect clients to in-person and online supportive programs locally in our community, and in some cases, provincial virtual programs, for example. There's been a lending library of iPads and Wi-Fi connectivity provided to participants in the program if needed. And it was really the first step in our frailty screening and wellness planning work, where we wanted to ensure that if frailty screens were being conducted to identify concerning components of health for our older adult population, that was being done in a primary care office, for example. We wanted to be sure that there were options to refer clients to that include our community support service providers, and then further on into more intensive interventions such as our geriatric assessment and intervention network programs. Next slide, please. This digital health bucket, so that navigation is digital health is very much a key enabler of integrated care. Really, integrated care is focused on the ability to share information across multiple care settings as a key enabler of effective care. So starting from the beginning, we focused a lot on navigation and ensuring that our community knows what services and supports are there and that there's an ease of referral options for clinicians. We're looking at now the Ontario Telemedicine Network and the Patient Access Network modernization, which is for anybody who's ever accessed it's formerly known as the OTN network. These are virtual specialists that work side by side with an in-person nurse and the patient at the elbow, so to speak, in an actual clinic setting to ensure that it's particularly relevant and ensures connection to specialty services as appropriate without having to drive all the way to Kingston or South Lake, etc., to access. So we're focusing this year on really making that an easy system to access and rebuild it after COVID, because it certainly took a bit of a hit during the COVID time with the proliferation of privacy compliant platforms, etc. But this has a real clinical component to it that's of great value for many of our community members. We will be looking at the Shared Health Information Integration Portal, affectionately known as SHIP, which allows for better data visualization of the population health data and coordination of care across multiple service provider agencies. So there's actually functionality in this where shared coordinated care plans can be housed, and it's an Ontario Health East asset. So there's a lot of attention being paid to furthering its functionality and capacity to support our service providers in providing that integrated care. And always we have ongoing increased access to online appointment booking with our primary care partners and are always looking for strategies to enhance that uptake. Next slide, please. So I spoke earlier about the congestive or chronic heart failure integrated care pathway work that we've been at for a while. We have focused on standardizing patient education materials. So this is, and we had to start somewhere in terms of a pathway. Where does the pathway actually start? We chose hospital discharge. So heart failure patients that have been admitted to hospital for an exacerbation of that clinical condition, what happens when they're discharged? How are they supported in the community so that they don't end up representing to hospital unnecessarily when those supports could have been provided in home along the way. Our community paramedicine partners have been beyond instrumental in helping us articulate what this can look like. We've really focused with them as the key area for support and development, provided in-service education for our community paramedic partners in both the City of Kawartha Lakes and Haliburton County, so that they feel better equipped to support patients this way, and increasing the amount of remote care monitoring apparati that are available. So these are peripheral kinds of monitoring devices that can alert community paramedics, for example, when a vital sign is outside of the range of comfort, et cetera, et cetera. So it's got some great potential for our system moving forward, currently and moving forward. And we've been engaging lived experience partners in the feedback, particularly around these patient education materials and how if they provide support to them in their care journey. Further development in this realm will be, first of all, also expanding to chronic obstructive pulmonary disease and looking at digital health enablement for collaborative care, incorporating an understanding of existing programming and what's on offer from our various primary care providers, and engagement with specialists and a pathway from non-acute care settings so that we can prevent that hospital admission from happening in the first place. Next slide, please. Our mental health and addictions work has been slowly emerging, and I say that it's quite planful that it's been slow, in the sense that we recognized it very early on as a real priority, but there's also been an awful lot of work regionally and provincially happening in this space. So we wanted to have an opportunity to kind of figure out what's specific to our OHT region and how we can align with some of the changes and transformations that are happening at the regional and provincial tables. So we held a forum in the fall of 2023 that had over 60 service provider partners from across multiple sectors, from OPP to community paramedics to mental health and addiction service providers, primary care, hospital, etc. And we spent some time really looking at where our priorities need to be as an Ontario health team in advancing integrated care in this sector. And the first piece that was highlighted was that we need to support locally the implementation of Access MHA, which is a regional Ontario Health East initiative, and it's a system of coordinated access for intake, assessment, and referral across, and we will focus on mapping local pathways and improving transitions in care across that continuum from service provider setting, et cetera. Enhancing primary care relationships and including persons with lived and living experience in system planning and design. Next slide, please. Palliative care, again, some emerging work happening in this space. We've got such a passionate group of palliative care community teams and palliative care providers that are very dedicated to ensuring that palliative care is high quality and available to everyone. And so they've been focusing first off on enhancing the awareness of our community-based interdisciplinary palliative care teams in both CKL and Haliburton County. And we will be piloting the use of this shared health information integrated portal to support care notification. So for example, if a palliative care patient of the palliative care community team presents in hospital or in emerge, there's a notification automatically to their palliative care team members so that they can follow up appropriately and ensure that support is provided at the right time. And we will be looking at optimal models of home care in rural communities. As you know, I'm sure that this has been a huge strain across our province, but really has hit rural communities very hard as the health human resource crunch. So what kinds of models can we explore, and what might be on offer for us as funded models to really increase the access to home care, particularly in the palliative care space, but not exclusively, but that's where we will start our conversation. Next slide, please. So where we're going, I won't spend a whole lot of time on these slides, but All 58 Ontario health teams have received $750,000 per year for 3 years. 12 of those 58 have been accelerated to receive designated status under the Connecting Care Act. And those 12 are really functioning as early adopters and providing us with the learning and readiness assessments for the rest of the system to kind of move along in lockstep in our maturity journey. But they're the lightning rod, so to speak, for the guidance and documents, templates, and accept reality of what Ontario health teams can do on the ground. So we watch with rapt attention to what's happening with those initial 12. Next slide. So this designation status that I spoke about, we as Kawartha Lakes Haliburton Ontario Health Team, like the other 58, are currently considered approved Ontario health teams, but we are not designated under the Connecting Care Act legislation. So in order to move forward to be designated, these are some of the pieces of work that we have to focus on, which is we have to create a non-for-profit corporation. We have to establish or align an existing primary care network, and we have to select an operational support provider, and that is an agency that would provide finance, human resource, and that back office support for an Ontario health team. And so we will be required to have these pieces in place in order to establish the next pieces, which are really home care readiness and the ability to receive funding for integrated care bundles, I would say. Next slide, please. And so primary care networks are a big topic of conversation across the province. And really these can certainly take a local flavor and fulfill the functionality of as determined by the local primary care voice. But that they need to be opportunities to connect primary care members within an Ontario health team and act as that voice in Ontario health team decision making, and also provide that single point of access in terms of consultation from a system perspective and with what clinical change management and ideas, solutions, digital solutions, et cetera, that are on offer to primary care across the province. This is a great opportunity to facilitate that access to clinical supports and improvements for primary care as a whole. So there's some synergies and efficiencies to be found there. Next slide, please. So this is the patient impact that the Ontario Health is sort of positioning as the value proposition for Ontario Health teams to do all this work. And the initial OHTs are really going to be focusing, and we are as well, on implementing supports for unattached patients and for early detection, intervention of chronic disease, et cetera, improving system navigation, understanding what home care readiness means. It seems to be a bit of a moving target, but we have a fairly decent appreciation of that, at least in first stages, and then implementing the clinical pathways that I mentioned way back in the beginning. But all of these initiatives built on the foundation, a strong foundation of primary care engagement and population health and equity approaches to improve patient outcomes. Next slide, please. So the laundry list, these are just highlights moving forward, and most of which I've spoken about, but we will be expanding and refreshing our engagement to include Haliburton County service providers and community who joined our Ontario Health team last year when we transitioned to Kawartha Lakes Haliburton Ontario Health team. So we're going to take some opportunity to really make sure that we're doing a good engagement with service providers and our whole OHT as a whole. Certainly there's value in that with the new and emerging direction that's been provided to us from Ontario Health. So we will be seeking, moving forward on the steps required for Ontario Health Team designation. And I think the majority of the work that I have on this list, I have already spoken about. So I will conclude my piece there. Amanda, did you want to comment at all about the Lunch and Learn series? Or?
Sure, yeah, just on this slide here, we've just shown the previous Lunch and Learns that we've done. These are all available, the recordings, on our website. If you go to klhoht.ca/resources, they'll be at the top there if you wanted to look at at any of the previous ones that we've done. So like the last one, for example, was about the community paramedic program in Corth Lakes and Haliburton County. All the other ones are there too, and the recording of this will be on there as well. So that was just a little plug to visit that and check out our past episodes as well.
Thank you.
And then with that, I think we just have time for questions. Looks like we have about 10 minutes. If there's anyone that had any questions, you can feel free to come off mute. You can put them in the chat as well. We'll see them there. But welcome any questions at this point from anyone.
Can you hear me?
Yes, we can hear you. Is that Brian?
That's me, yes. Okay, so my question really is about the area that this covers. I live in Kirkfield. The Ross Memorial is the hospital I go to. I spent 3 or 4 days there in 2017, and then they set me up with community care, which is in Coboconk. But my doctor now is, family doctor is in Aurelia.
Mm.
So is she, party to any all my what's going on at the hospital and the home care with nurses and
Yes, so yes. So in terms of your physician's ability, primary care provider's ability to access your records at Ross Memorial, yes, absolutely. That would be available to them.
okay.
The home care is standardized across the province, so there's a same access point for all physicians and nurse practitioners to make referrals to home care. So that is all still similarly available.
Okay, well, it just seemed that they did a good job, I'm walking.
I'm glad to hear that. Yeah.
But anyway, but it just seemed a little disconnected because the hospital set me up with a personal service worker who came. And after a while, because this injury wasn't healing properly, she said, you need a nurse. And then somehow, I don't know, I forget who did it now, but somebody had to set me up with the nurse
Right.
service from the community care.
Right.
I kind of wondered, well, why didn't somebody do that in the first place?
Well, can't comment on that. I don't know. But certainly, yeah, that's a big feature of the work that we do. We're recognizing these boundaries of our Ontario Health team are porous. People travel across them all the time. And so we always have a lens to what's happening in our neighbors, especially, to make sure that we're all at least aware of, but the levels of care, certainly in respect to home care, should be no different, regardless of what side of the boundary you're on.
Okay, I'll let others ask their questions now. Thank you.
Yeah.
Thanks for the question, Brian. Was there anyone else that had any questions? I don't see. Oh, there's one that's come up in the chat. What is the difference between the health unit and the Ontario Health team?
Okay. So I would say scope of work. So certainly public health unit is a partner with us in the Ontario Health team. So they have a mandate in terms of health promotion, protection, etc., which is different than direct service provision around primary care, hospital services, community care, etc. So we certainly work in partnership on many initiatives. Our service providers do, but they're quite different in terms of their mandate and organization.
Hey, thank you for that question, Judith. I don't see anything else that has come up in the chat, and I don't see anyone else coming off mute. Oh, no, we have one from Christina. She said, I'm the owner of the Well Body Group in Fenland. Are there any private service providers part of the network?
There are not. The network is exclusively for publicly funded, which we are using on public dollars to do. So at this, we are limited in being able to provide navigation to publicly funded, not-for-profit agencies, service provider agencies.
Thanks for that. And thanks for that question, Krista. So I don't see anything else coming through. We're sort of 4 minutes to 1. With that, I think we can wrap up. I'll say if anyone has any other questions that come to mind that they'd like to ask us, you can always email us at info@klhoht.ca. I will be sending a follow-up email as well, just as a thank you for attending, and I'll include a link to this recording as well, so you have our email address too. But with that, I'll just want to thank everyone for joining on today, and hope you have enjoy the rest of your day. Thanks, everyone.
Thank you.
Thank you.